Good morning. The first item of business is general questions, and at question number 1 I call Stuart McMillan.
Thank you, Presiding Officer, to ask the Scottish Government whether it will provide an update on its plans to introduce regulation for pet groomers, animal boarders and dog walkers in light of the results of the public consultation from earlier this year that showed a high level of support for such measures.
Mr Jim Fairley.
Thank you, Presiding Officer. While the consultation undertaken last year demonstrated support for licensing, concerns were also expressed about the proportionality and cost of statutory licensing and about the capacity of local authorities to absorb and meaningfully enforce additional licensing requirements when budgets are already stretched. We are therefore assessing whether less onerous and more proportionate approaches, such as registration schemes linked to codes of conduct, could deliver similar outcomes to licensing. Meantime, our immediate focus is to deliver on the proposal to regulate canine fertility businesses due to the significant animal welfare concerns associated with this sector.
Stuart McMillan.
Thank the Minister for that reply. And those of us who have pets recognise that they are treated like one of the family, and it's reasonable then that pet owners want reassurances that any services that they access are insured and staff appropriately qualified, which hasn't always been the case, as the Minister will know. Now, will the Minister commit to consulting the sector more widely to understand the scale of growth in pet services in Scotland, with the intention of developing a proportionate yet robust regulatory framework covering the sector to protect pets from harm?
Minister.
I wholeheartedly agree with the point that the member makes, that pet owners need to be reassured that persons providing pet services are suitably insured and qualified. So I therefore encourage any pet owner accessing such services to undertake due diligence and to confirm with the service provider that they are indeed insured and qualified. On the point about further consultation, this is not something that we propose to take forward at this time, but the Government will, of course, continue to engage with stakeholders in order to develop proportionate controls for pet service providers in Scotland.
Question number 2, Mark Ruskell.
Thank you. To ask the Scottish Government whether it will provide an update on how it will ensure that all appropriate roads have a safer speed limit of 20 miles an hour by 2025.
Cabinet Secretary Fiona Hislop.
The Scottish Government is firmly committed to reducing road casualties and creating safer streets for everyone. Evidence shows that a person is 7 times more likely to survive if hit at 20 miles per hour than 30 miles per hour. All local authorities are committed to meeting the 2025 deadline and have developed their own plans designating their own streets, and £4 million has been provided to 21 local authorities this financial year to aid implementation. Transport Scotland has issued national guidance to support local authorities with the rollout of the 20 miles per hour speed limits on appropriate roads, and early feedback from Borders and Highland Councils as early adopters has been positive, with a recognition by local communities that this initiative can significantly reduce road casualties, encourage sustainable travel and foster safer, more vibrant communities.
Mark Ruskell.
Well, can I thank the Cabinet Secretary for that answer? It is clear now that every single council in Scotland is ready to roll out 20 miles an hour, and that is remarkable. It means that by the end of next year, potentially every child in every community could be living on a safer street in Scotland, and that local level implementation alongside a national programme is really going to help to drive forward national road safety messages that have been so successful in Wales in driving down casualty rates. But, Cabinet Secretary, when I speak to councils and COSLA, there is uncertainty as to what funds will be available to get the job done in the next 12 months, particularly staff resources within councils. So can the Cabinet Secretary provide clarity as to how the budget announced yesterday will enable each and every one of those 32 councils to deliver that implementation plans in the next year? Because it's clear it's going to cost more than £4 million.
Cabinet Secretary.
So road authorities had submitted expected expenditure to deliver their own plans to achieve the 20 miles per hour limits on the roads they have chosen in their own council areas. However, we know that early adopters have spent significantly under these estimates, in one case by 62%. So therefore, we're confident there are sufficient funds to meet the needs in the 2025-26 budget, and that can be found in the road safety line in the roads budget that was published yesterday.
Brief supplementary, Sue Webber.
Thank you, Presiding Officer. Bus passengers in Edinburgh face longer journeys under Council's plans to cut speeds from 60 miles an hour to 20 miles an hour. The proposed changes are expected to cost £850,000 and would affect 66 roads in Edinburgh. Lothian buses have raised concerns that the slower traffic will affect journey times for passengers, adding to the misery commuters face across our capital. Yet only 18 fines for breaching the 20-mile-an-hour speed limit in Edinburgh have been issued since 2021. Without enforcement, this is nothing more than an expensive box-ticking exercise. Does the Cabinet Secretary agree that introducing more 20-mile-an-hour limits will increase congestion and journey times and do nothing to encourage people to use public transport?
Cabinet Secretary.
Well, I'm not sure if the Conservative Party are aware of the data and the information that shows there are significant reductions in the number of casualties on affected roads, and that is the driver for this change and improvement. In terms of enforcement, she'll be aware, because I know that she's a former Edinburgh councillor, that she will know about the powers that local authorities have themselves in this point. She does make a point in terms of the issue around whether 20 miles per hour actually slows the traffic, and there's an issue around congestion and whether in terms of that congestion affecting bus travel times. But of course, again, that's an issue that the Edinburgh City Council, who of course own the buses in Edinburgh, can in terms, well, they run a publicly.
Ms Webber, if you would allow the Cabinet Secretary to respond. Cabinet Secretary.
So Lothian buses have shareholders. Some of them, a very small amount is West Lothian. They have shareholders, which are also Edinburgh City Council. And I would have thought the transport spokesperson for the Conservatives might have known that. Yeah. So in terms of putting forward a reasonable case for how do we make sure that we get the benefits of increased bus use, but also safer streets, I would refer to her to speak to her former colleagues in Edinburgh City Council in the Edinburgh-specific issue.
Question number 3, Richard Leonard.
Thank you, Presiding Officer. To ask the Scottish Government what steps it is taking to maintain and grow supported businesses.
Mr Ivan McKee.
The Scottish Government values the role of supported businesses and is committing to helping them achieve commercial sustainability. In Scotland, we pride ourselves in leading in this area with both legislation and systems that support that. Legislation such as the Procurement Reform Scotland Act 2014 contains a number of provisions to support supported businesses, and the multi-supplier dynamic purchasing system for requirements reserved for supported businesses describes a range of products and services that supported businesses can provide to the public sector. And recent data shows that almost £28 million of public sector spend was spent by public bodies with supported businesses in the previous year. Supported businesses are also included in the recently published Social Enterprise Action Plan. And I'm working with officials to provide further guidance to public bodies to set guidelines on how much they should seek to spend with supported businesses across the country.
Richard Leonard.
Can I thank the Minister for that answer? Haven Products in Larbert, with 9 out of 10 of its workforce disabled, is facing closure. I've been pressing the Government to act to save these jobs for over 6 months. As of today, neither the Government nor its Short Life Working Group has come up with a plan to save the factory. And this week, the Board of Haven confirmed that unless this situation is resolved, redundancy consultations will begin in early January. Will the Minister agree with me that the time for words has long passed? These workers need action. Will he give an undertaking today that a rescue plan will be put in place before Christmas to save these vital jobs?
Minister.
I absolutely agree with the member, and I thank him, genuinely thank him for bringing this issue to the Chamber. I have met with the Chief Executive of Haven Products, and I believe that the Chief Executive will be visiting the Parliament in the next few days at the request of Mr Leonard. I have been working tirelessly on this matter to support Haven and indeed other supported businesses, because we absolutely recognise, not just because it's the right thing to do, but also, frankly, partly because it's more cost effective to support these businesses than it is for them to close, and for the individuals concerned to have to be supported through cost to the wider public services. So I'm absolutely committed to doing that. The member will be aware that we work within regime round about what we can and can't do with specific procurement requirements, but I have asked officials that we need to deliver on this. We need to make sure that Haven and other supported businesses are supported. They have identified opportunities in the medium term, which is very welcome, but as the member rightly identifies, what needs to happen is delivery of orders and financial support in the immediate term, and they can rest assured that we are working to make sure that that indeed will happen.
Briefest of supplementaries, Colin Beattie.
The Scottish Council for Voluntary Organisations has estimated that Labour's national insurance hike will cost the sector £75 million, with Edinburgh Social Enterprise Foursquare warning that after Labour's tax hike they have nowhere left to cut. Can the Minister advise what assessment has the Scottish Government made of the impact of these changes in the third sector, and can he outline how the Scottish budget announced yesterday is supporting third sector organisations, including social enterprises?
Briefly, Minister.
Yeah, the member raised a very important point. Those measures that have been taken in the UK budget have a significant impact on the sector. We are working with the sector, indeed others, to understand the full impact of that, and are having negotiations with UK Government to secure funding for all of those organisations impacted in Scotland as a consequence of those actions. And you will know that the Scottish budget published yesterday has a range of measures to support those enterprises.
Thank you. Be grateful for concise questions and responses. I call Colin Smith at question number 4.
Thank you, Presiding Officer. To ask the Scottish Government what its response is to Public Health Scotland's recent NHS dental monitoring report, which indicates that almost 40% of adults in Dumfries and Galloway are not registered with an NHS dentist.
Minister Jenny Minto.
Thank you, Presiding Officer. The Scottish Government has made available tailored grant funding, and the Board recently had a successful Scottish Dental Access Initiative application, which will result in 2,000 new NHS registrations in Muffet. We're also funding dental emergency evening clinics for unregistered patients, which have been in operation for almost 18 months. Officials are working closely with the Board to ensure that measures are in place for appropriate staffing of the Garden Hill and Castle Douglas practice to support the provision of emergency and urgent care to unregistered patients and provide routine dental care for a number of registered patients within priority groups.
Colin Smith.
Minister, it's not just adults. Over 20% of children in Dumfries and Galloway are not registered with an NHS dentist, the worst figures in Scotland. And the actions that she outlines there are clearly not working. The problem has been getting worse. So why is the crisis, Minister, so bad in Dumfries and Galloway? Why is the action not making a difference? And more specifically, more importantly, what more will the Government do to tackle the crisis before NHS dentistry frankly becomes a thing of the past for far too many of my constituents?
Minister.
I thank Colin Smith for his question, and he will recognise that prior to Brexit, a large proportion of the dentists within Dumfries and Galloway and in other rural areas of Scotland came from European countries. I recently met with Secretary of State for Care Stephen Kinnock, MP, as well as my counterparts in Wales and Northern Ireland, to talk specifically about how we can improve the recruitment of dentists in the United Kingdom, because this isn't just an issue in Scotland. Also, Colin Smith will be pleased to recognise the important investment that the Scottish Government has put into the budget for next year around dentistry, and I suggest for him, that if he continues to support the Scottish budget in this, so we can continue this improvement. Thank you.
Question number 5, Douglas Lumsden.
To ask the Scottish Government whether it plans to update planning guidance for battery energy storage systems.
Minister Alistair Allen.
Where new development proposals come forward, our 4th National Planning Framework, published and adopted in 2023, ensures the impacts of proposals on communities and nature are important considerations in the decision-making process. On the 5th of November, NESO published advice to the UK Government on how to achieve clean power by 2030. At the same time, NISO also published consultations on the connections queue reform, and the UK Government is due to publish a Clean Power Action Plan. The outputs of this work will be considered in due course.
Douglas Lumsden.
Presiding Officer, at present there are 18 battery sites operational. A further 18 are under construction. There are 132 sites with planning permission granted, awaiting construction, and a further 136 sites with planning permission submitted. It's completely out of control. One developer told us there is a gold rush to get these in the planning process before the SNP government puts controls in place. So can I ask the Minister if the Government will consider a moratorium on new applications until we have an energy strategy and can evaluate how many of these battery sites are required and where?
Minister.
Well, I think it's important to say that there is a statutory structure which must be followed in all decision-making in the planning system. And Section 25 of the Town and Country Planning Scotland Act requires that decisions must be made in accordance with the development plan. I understand the point that the member is making, I think, about cumulative impacts. The cumulative impacts of development, including landscape and visual and amenity impacts, are important considerations in the determination of applications where such impacts are identified.
Question number 6, Claire Baker.
Thank you, Presiding Officer. To ask the Scottish Government what it is doing to improve rail services for passengers in the Mid-Scotland and Fife region.
Cabinet Secretary.
I appreciate that services in Fife have been affected by overcrowding for some time. ScotRail is working hard to increase the capacity and improve the resilience of services, and has recruited more maintenance and engineering staff as well as train drivers. Newly recruited engineering staff will allow for 2 high-speed trains to be returned into service between Glasgow and Aberdeen from the December timetable change, which will release diesel trains for other parts of the network. Additional stops will also continue to be made at Dalmeny and Burnt Island to reduce pressure on busy morning and evening leave-in services. The electrification work between Edinburgh and Dalmeny has started. This is the first step towards electrification of the Fife routes in Mid-Scotland and Fife, which sees a reliable service. ScotRail is adding longer trains to Saturday on Glasgow to Alloa lines to meet the growing passenger demand.
Claire Baker.
Thank you. The Cabinet Secretary has identified a number of issues with the trains in my region, but I want to ask about ScotRail's proposals to to adjust the hours of 54 station ticket offices, which conceals the fact that there's actually 47 stations that will change their hours right across my region. I do feel there's a lack of transparency around these plans, and they're not being clearly communicated to the public. The 2022 consultation showed that passengers did not support changes to ticket offices, and the Government's own report into the safety of women and girls emphasised the importance of having visible station staff. The ongoing consultation does not include members of the public, so how will the Cabinet Secretary ensure that the needs of all passengers are heard, and can she confirm that ScotRail will provide an up-to-date equality impact assessment?
Cabinet Secretary.
On that latter point, yes, that point has already been made to a number of members. In relation to the issue, she'll know that there's not been adjustments of ticket office opening hours for 30 years. There's been a reduction in sales from ticketed offices from 78% to 14%. I'm glad she corrected herself that there aren't ticket offices closing, they are being adjusted. And in her region, Cowdenbeath will have opening times reduced, however, staffing hours remain unchanged. Cooper will see opening hours actually increase. Dalmeny will have opening times reduced, however, staffing hours remain unchanged on that line. Dunfermline City will have opening hours increased, and also in terms of Lookers, opening times will be reduced, however, staffing hours remain unchanged. Visibility on platforms in stations is important, as she stresses, and that is the focus on adjustments that are being made and currently consulted on with staff.
Thank you. A concise question 7, Jackie Dunbar.
Ask the Scottish Government how it is supporting NHS Grampian with its winter preparedness.
Cabinet Secretary Neil Gray.
Thank you, Presiding Officer. Earlier this year, the Scottish Government and COSLA jointly published a plan setting out how we will address the exceptional pressures facing our health and care services over winter. Building on previous experience, we're supporting local systems, including NHS Grampian, with a comprehensive whole-system range of effective measures. This includes preventative actions such as vaccination programmes, ensuring people receive the right care in the right place at the right time through measures such as hospital at home, and public messaging campaigns, maximising capacity and capability in the system and focusing on the well-being of our workforce.
Jackie Dunbar.
I thank the Cabinet Secretary for that answer. Following the critical incident declared last week in the NHS Grampian, can the Cabinet Secretary speak to the actions which the Scottish Government will take to alleviate pressure on A&E services in the winter months and ensure the most effective care possible for patients?
Cabinet Secretary.
Yes, I thank Jackie Dunbar for that question, and also want to put on record again my thanks to the staff in NHS Grampian and those other boards that were involved in responding to the critical incident. I recognise clearly the relationship that there is between long waits and overcrowding in A&E and increased risk of harm. That's why the budget for next year is investing in waiting times action and to address capacity in primary and social care. That, Presiding Officer, can clearly only happen if colleagues vote for it. But also we continue to work now with health boards and the Centre for Sustainable Delivery to enhance patient flow at acute sites, improve discharge planning and hospital home services, and reduce conveyance of people from care homes where clinically appropriate, all of which will turn into reduce A&E pressures. Finally, officials continue to meet regularly with NHS Grampian specifically to discuss improvement activity underway within the board and any challenges that they are facing.